Next, I'd like to invite up Alisa Apreleva.
Good afternoon. I'm very happy to be here to present to this community. And before I proceed talking about music therapy, I would like to ask you if any of you here have had any personal or professional experience with music therapy. Could you raise your hand? And if you never had this experience, could you raise your hand? Okay, quite a lot of you. So I'll start with the definition. Music therapy is essentially using music therapy and its elements to support human health and well-being. And music therapists as professionals are not only trained in use of music and its elements in improvisation, songwriting, song singing, but also we do know basics of medical science, we know basics of neuroscience, psychotherapy, and so on. And this is why we are a great part of a multidisciplinary team. We love supporting palliative care specialists, we love supporting speech-language specialists, physical therapists, physicians in their work, but we can also provide services on our own, knowing the goals for the particular client. There is some research on music therapy for ALS, but it is quite limited, unfortunately. We do know that music therapy supports well-being and psycho-emotional condition for persons with ALS. We know that music therapy helps to improve communication, and it decreases perception of physical symptoms in hospitals for patients with ALS. It also helped transition to non-invasive ventilation and decreased anxiety for mechanically ventilated patients. However, music therapy is rarely offered at the onset. It is often offered later in the disease, and music therapists are not included in multidisciplinary ALS teams, and we are not given chance to support ALS patients in physical rehabilitation, and I will speak about it in just a second. But firstly, I would like to say that we try to change this situation. When I started consulting ALS Moscow Center in 2013, we introduced music therapy early, and we included 2 music therapists into multidisciplinary team, and we had very positive feedback from our patients. Some of the techniques we use can be very simple, such as song singing, songwriting, and they could go deeper, for example, for grief work or for support of physical functioning, such as musical life review that helps to connect to the true self, to restore the personality for a person with ALS, or neurologic music therapy, which helps to support vital functions. Before we proceed with that, there is another question. Do you think there is a special area of the brain that actively responds to musical stimulation? Could you raise your hand if you think so? Thank you. Actually, the answer is no, because music engages the entire brain, and this is important to remember. So yes, there are some areas of the brain that are more musical, I'd say, but excuse me, music engages a vast network of regions in both hemispheres, and actually it shares important neural pathways with many vital functions such as breathing, perception, motor skills, memory, language. And this is why in the last 2 decades we found out that by providing specifically structured music activities, we could support these functions. And these techniques are used widely in stroke rehabilitation, traumatic brain injury rehabilitation. And it is important to think about rehabilitation in amyotrophic lateral sclerosis as well, because it can slow down disease progression and prolong lifespan. So we decided to proceed with the research to answer the question if music therapy could help support breathing, speech, respiration, swallowing, and cough for persons with ALS. And you can find more details at alsmusictherapy.org, but I'll just show some preliminary results. It is still work in progress. We have a lot of variables which we assessed. So this is a standard respiratory measure, and we see here that from week 1 to week 6, when we do not have any intervention, we just observe natural decline, and we expect decline to happen. Decline really does happen. In other contexts without therapy, we would expect this decline to continue at the same rate. But as we introduced music therapy, we see that decline not only slowed down, but also has been reversed. And the trend continued during the follow-up. So from week 6 to week 12, we offered 2 sessions of music therapy per week, home-based for each patient individually. And we also introduced individual exercises targeted for each person individually. And these exercises participants could choose to perform in the treatment period and in the follow-up period. We did not require them to perform these exercises. So we have similar trend for another respiratory measure. We have similar trend for swallow. Here, lower numbers mean better results, so we see the improvement. Could we have the video played? So here we see that a person with ALS bulbar form after treatment swallows 15 milliliters pudding consistency, and it is successful. Okay. We also looked at speech. So again, only some of the measurements we took. Maximum phonation time increased in treatment period. And sequential motion rate, the rate of speaking, increased as well. We have also some feedback from research participants. We took structured interviews, and one of them said, "It has become easier to speak. I have enough air to finish the phrase. It has become easier to breathe as well. I experience less gagging." And we were happy to find out that music therapy has been well tolerated and pleasant. And if you think of that, it is a whole hour of doing hard work. It is exercises. It is many things that are not going exactly as you planned, and you're learning. But people were still inspired, and they found it motivating. So what did we do? Essentially, it looked more or less like adapted voice lesson with warm-up, with some playing musical instruments, and with some singing exercises and song singing exercises at the very end. Unlike with stroke or traumatic brain injury, it was very important for us to look at the safety and tolerance for this protocol, because we know that strenuous exercise can be harmful for people with ALS. So we looked at a lot of relaxation in between moderate exercise, and at improving voice production techniques and learning efficient breathing, like diaphragmatic breathing or mixed breathing. And in addition to its neurological advantage, music does increase motivation. And we know now that lack of motivation is one of the most prominent behavioral changes in ALS. So this cocktail of happy hormones that occurs during live music making, it really helps. Also, we have mirror neurons hard at work during music therapy session, and our participants commented that it is way easier for them to perform the exercises when they work together with a music therapist, so you can see how we are in synchrony here. It is very important for success. And this is actually what music therapists are best at, in creating this relationship in music. This is our specialty. And this is why we can adapt to increasing disability and still maintain this ongoing relationship. In fact, in Moscow, family would not sometimes accept psychotherapists, but they would accept music therapists to enter their homes, and this would be the segue for the whole team to enter eventually. So again, some music therapy benefits for persons with ALS. You can find the PDF to download at alsmusictherapy.org. And the benefits are many, from psycho-emotional support to pain alleviation and caregiver stress management and respite care for caregivers, including children. We work with children. And if you do not have music therapists in your community, you could do what we started with. We started with training 2 groups of musicians, volunteers, as ALS visitors. We taught them ALS-specific skills and therapeutic music skills. They, of course, cannot work with profound grieving situations or depression or physical rehabilitation, but they provide good psycho-emotional support to patients and families. So we go to some learning points, and the first one is introducing music therapy as early as possible as supportive modality of multidisciplinary ALS care has a potential to increase quality of life and well-being of persons with ALS and their loved ones. Very important thing is that music therapy protocols can be used for physical rehabilitation of persons with ALS, including bulbar and respiratory functioning. And music therapists can be trained to support people with ALS and their families. I have too many people to thank. Many of you are present here. I'm very grateful for all the sponsors and pro bono expert advisors, private donors, including Stephen Hawking Foundation, Remedy Wave, Bose Company. I'm still fundraising for the next year, so if you have this opportunity, please visit experiment.com and help us. But in any way, I do believe that music can be this not yet fully discovered remedy for ALS, in similar way as currently music is so popular in treatment of people with Alzheimer's dementia. It's funded through governmental organizations. I feel that it may be the case with ALS, and I would like you to join me in this discovery in later multi-centered study in, if you need support to train musicians, volunteers, or music therapists. And since I'm between United States, UK, and Russia, it should be easy to do. I'm looking forward to speaking more with you about that, and I'm grateful for this opportunity to present here. I'll take your questions. Thank you.
You don't have to wait. Go ahead, ask your questions. How many music therapists do you have?
Excuse me?
How many music therapists?
How many music therapists in the world or in Russia?
In Russia.
In Russia, we do not have profession in Russia, so we train specifically 16 persons, 2 of whom stayed with the foundation. Yeah.
Do you know how many are in the world?
In the world, it is about 70,000.
Huh?
So it's a lot, but expertise can vary. So, for example, not everyone would be trained in neurologic music therapy.
No more questions?
Well, thank you then.
That's fine.